I'm Lwin, and I'm from the Wee Kim Wee School of Communication and Information at Nanyang Technological University, Singapore. You know, a lot of the work that I do in health communication today is about population health, and it's about, looking at really larger facets of what concerns large groups, right? So if you talk about COVID-19, that's very much a facet of public health concern globally. And, I would probably say that I was interested in many different types of health communication issues. But I think that in early 2010, I had the opportunity to go to many countries to study about what were the health issues that concern many of the doctors and the medical fraternity in those countries. And I remember that I went to hospitals which were really overcrowded during the monsoon season, right? And they would talk about how public health concerns like infectious diseases can have an impact on such a large scale. So what it means is that, everybody in healthcare and in hospitals would be trying to do their job to look after the patients. But then when you have an incident like COVID-19, well, in those days, it was about malaria and dengue. So every year during the monsoon season, they would have a high incidence of dengue. So what happens is then the task of the hospital, would be multiplied. The number of beds that's available becomes a lot smaller, and all the other issues become multiplied. So that got me interested in, looking at trying to tackle infectious diseases on a large scale, and that's been one of my research trajectories since. I think one of the things that's always surprising to me is how small facets of communication can have such a large impact when you tackle it across populations. I've been doing work in Sri Lanka, for example, and in Colombo, there is a huge incidence of dengue arising from people's behavior pertaining to how they interact with water ponding in their vicinity and so on. So if we're able to get the population just to do like very simple actions, right? Just getting rid of the water that's ponding or putting certain tablets that can kill some of the mosquito larvae, then on a large scale, you can have a huge impact, a large percentage drop, or even large numbers of people whose lives can be improved because of the control of the dengue spread in the community. So small behavior interventions that lead to huge impact on a large scale. We have experts who are coming from many different countries, and sometimes we would hear about how a particular intervention has been undertaken or how certain type of training has been successful in a particular country. And the fact that we are able to then share that knowledge together, it allows us to kind of take the best practices from across the world and then apply it to our communities, our various areas of research, and to think about how they can be translated on a much larger scale. So it really kind of helps to multiply the efforts, right, of many of the scholars in the field. That's kind of a tough question because I can think of quite a few traits, but at this point, I would actually use the time point as a context to select. I'll just give you a little bit of background. We've been looking at the social media conversations across COVID. I started in January, and we've been tracking how people were talking about COVID across social media. And then we're trying to analyze the sentiments. One of the things that we've learned was what you would expect during any pandemic. You've got very large amounts of fear. We saw that right up front, and then, that's kind of been coming down, I think, as the populations understood, how we could tackle this particular disease. But then over time, there's been an increase in very negative sentiments like anger. So across the world, we see this sentiment of anger rising to such an extent that in June, it was even higher than fear. So imagine you've got such negative feelings amongst populations, right? Anger and fear. And of course, those just encapsulate many different other types of feelings within that cluster. So anger could have components of hopelessness, distress, and so on. But then slowly along that trajectory of different countries, we also started detecting a cluster that really encapsulates all the different components of hope, inspiration, celebration, and even kind of resilience and belief in humankind. And that helps me select the word, which I think I would select hope right now, because, that's what I think like humanity needs at this point. And for us to see that, there's going to be a better day in the future and we all can work together for a post-COVID world that's going to be wonderful for humanity again.